Hi, my name is Anya Cannon, and I am a third-year medical student. This is a 5-minute thesis on a project titled Endocrinologist Concentration and its Effects on Diabetes Management in Appalachia. The reason we started this project was because Ohio falls short of the national average of physicians and has a diabetes prevalence of 12.4% as of 2020. But why should we care about this? Because diabetes can be both deadly and devastating. It's the 8th leading cause of death in Ohio. It can cause fatal complications like ketoacidosis and hyperosmolarity, and it causes long-term complications such as nerve and kidney damage, vision loss, and heightened risk of cardiovascular disease, just to name a few. On top of this, diabetes and its complications are expensive for both the patient and healthcare system. Ohio has such a diverse range of areas, from rural Appalachia to crowded cities, so this prompted us to take a closer look at how diabetes is distributed throughout the counties and whether it has a relationship with the distribution of endocrinologists and whether that distribution influences the prevalence of diabetic complications. In our review of literature, we found a similar study that was done in Texas, which found that the counties of Texas that had higher diabetes prevalence, there were fewer endocrinologists. A nationwide study also found that access to endocrinologists is more limited in rural Midwest, South, and Southwest United States, and this evidence provides a glimpse into the maldistribution of endocrinologists in rural areas, and we wanted to explore that further in Ohio. Ohio has 88 counties total. 32 out of the 88 counties are considered part of Appalachia. In these rural areas, limited transportation, poor internet access, fewer healthcare facilities, and other social determinants of health pose significant challenges to delivering quality healthcare. In addition, Ohio has 13 counties considered southeastern, and we included this area in our analysis to see if there would be any additional differences here. Our results showed that of the 233 endocrinologists examined, only 18 practiced in the Appalachian counties. So this data revealed that the Appalachian counties had significantly lower proportion of practicing endocrinologists, lower mean number of endocrinologists per county, lower proportion of counties with at least one, and a higher prevalence of diabetes. Only a quarter of the Appalachian counties had at least one endocrinologist. Analysis of the southeastern counties yielded very similar results. Overall, less specialists, but higher diabetes prevalence. So what about cost, short-term and long-term complications of diabetes? Overall, the difference was not statistically significant between the regions. However, the southeast and Appalachian counties did show higher amounts of short-term complications. This implies that these counties are burdened with more hospitalizations secondary to short-term complications. We believe the lack of statistical significance may be due to a limited sample size in our study. The 2024 study of over 2.9 million people with diabetes found those living in small towns had disproportionately higher rates of both short and long-term complications. So this means that the regions we studied have higher rates of diabetes, yet suffer from an insufficient number of endocrinologists to treat that. This may result in more adverse healthcare outcomes, increased disease complications, and increased morbidity and mortality in these regions. This disparity is likely multifactorial, but should nonetheless be addressed. So what can we do? We can address the social determinants of health through outreach programs, which have been shown to be effective in connecting underserved rural areas with specialty care like endocrinology. These programs nullify the previous requirement of long-distance travel for patients. Collaborative care, which is a model that emphasizes communication and collaboration between the different medical specialties. A meta-analysis found that collaboration between primary care physicians and specialists yielded significantly lower hemoglobin A1C levels in patients with diabetes being treated by those PCPs. Specialized education program for rural PCPs, such as diabetes fellowships or didactic sessions. One study called Project ECHO implemented weekly virtual sessions between rural primary care providers and endocrinologists, which significantly enhanced primary care physicians' confidence in managing complex diabetes cases. Health education for the public to minimize diabetes incidence and complications, and policy changes. Despite the robust evidence of these interventions' effectiveness, southeastern and Appalachian Ohio remains underserved. There's a clear imbalance of endocrine care and diabetes prevalence in Ohio, and this imbalance needs addressed in order to provide equitable health care to all of Ohio. Policymakers should be encouraged to promote these programs, and subspecialists should be educated on the complexities of these regions and encouraged to serve within them. Thank you.